September is National Prostate Cancer Awareness Month. Prostate cancer is one of the most common cancers in men, but the good news is that it can be treated successfully if caught early. That's why a simple PSA test could make all the difference. Joining us now is Dr. Matthew Ferroni from Mercy Urology Clinic. Dr. Ferroni, thanks for speaking with us and tell us, why is early detection so important when it comes to prostate cancer?
Yeah, my pleasure. Thanks, Jackie. Prostate cancer is the #1 cancer that men face. 1 in 8 men in their lifetime will be diagnosed with prostate cancer. And I think there's this misconception that prostate cancer affects generally older men in their 70s or 80s. The reality is we're finding lots more prostate cancer in younger men, in their 40s and 50s even. And finding cancer as early as possible definitely gives us the best opportunity to treat it and oftentimes cure it.
How do you screen for prostate cancer?
Yeah, so 95% of prostate cancers are found with a blood test called a PSA, or Prostate Specific Antigen. It's blood work that generally primary care will get prior to a wellness annual visit, the same way they screen for cholesterol and kidney disease and those kinds of things. It's important that men know if they're being screened. In this day and age of My Chart, men can go on their medical records and find all their recent lab work and things. So look back and see if you're being screened. And if you're not, there may be reason for that, but definitely start a conversation with your primary care doctor or nurse practitioner about screening.
You mentioned those resources on My Chart, but do you have any more guidance on who should be getting screened?
Yeah, so the challenge is there's a couple different guidelines out there. The one that we endorse is the National Comprehensive Cancer Network, which basically states for men with a family history, either a father or brother with prostate cancer, or African-American men should get their first PSA blood test at age 40. For men that don't have a family history, 45 would be the first test. And generally, this is done about every 1 to 2 years, again, usually correlating to annual wellness exams with primary care.
What are some of the symptoms of prostate cancer?
Yeah, so it's always important to remember that a screening test, the whole point of a screening test is to find a problem before it causes symptoms. So majority of the prostate cancers we find, men aren't having any symptoms. And we'll hear all the time, well, how could there be something wrong with me? I feel fine. And again, that's the whole point. If we find cancers before men are having symptoms, then those are usually the cancers that are the most treatable. Now, it's important to mention that a lot of men do develop urinary symptoms from prostate enlargement as they get older. And although this could still require a referral to urology and a conversation about treatment, oftentimes this is unrelated to prostate cancer. So again, always important to be screened even when men are feeling fine and not having any problems.
And what advice do you have for wives or family members who want to encourage the men they love to get screened?
Yeah, that's a great question. So it's so important that spouses and partners take an active role in healthcare and healthcare screenings. A lot of men do stay away from doctors. I think that's just been a traditional cultural thing, especially here in Iowa. A lot of men just kind of feel if I'm not sick or nothing's bothering me, I don't need to see a doctor. But the reality is that to help protect loved ones, encourage doctor visits routinely, encourage screening tests, not just for prostate cancer, but colonoscopies for colon cancer, mammograms for women for breast cancer. All of these screening efforts are meant to make sure that your loved ones are around for as long as possible.
Yeah, absolutely, very important. Dr. Ferroni, thanks for joining us here today.
Thanks, Jackie. My pleasure. Take care.
And stay with TV9. We'll be right back.